All right, welcome you guys. This is Wellness Wednesday with Camie, Cragg, Lyman, and also it's a pleasure to introduce you guys to Dr. Jonathan Spivack.
Thank you, Camille.
He is a neurologist, and he does call me Camille. So if you guys hear this, he is one of few that gives me my full name or my real name that my mama gave me. But you are within Renown Hospital.
Correct.
Neurosciences Institute.
Correct. That's correct.
And what do you do there?
We're a collection of neurologists in general. Each one of us has an area of interest. All of us deal to a great degree with people with migraine, and that is the topic we're going to be talking about tonight. But it's general neurology for the most part.
Cool. So, Doc, okay, and I call him Doc, he calls me Camille. This is the real us right now, okay?
This is it. We're good. We're
I'm
good
not going to get in trouble, right?
No,
you Doc?
no, definitely not.
So check it out. I marketed this one time on Instagram today, and I got this text, and it says,
Right.
This topic speaks to my soul. And from what I know, I get a lot of clients that text me, and they're like, not coming in today.
Right.
I'm debilitated.
Right.
And I don't use this word often, but I cannot move. I cannot see. I can't even think about working out.
It's true.
And it's
really
because of
true.
what? A migraine.
It's a migraine. People who get migraines get it. People who don't get it. It's not just a headache.
Like, what's wrong with you?
Migraine is a disabling condition. I mean, I talked with you about this before. The World Health Organization labels migraine as one of the top 15 disabling conditions across the world. If you look at the numbers, I wax scientific here, it's boring, but the impact is phenomenal. At least $30-40 billion a year is lost financially simply because of people missing work, etc. So this is a very real disabling process.
Right.
The thing is that people live through it. It doesn't kill. I don't sound glib about death, but people live through it, but it is horrendously disabling. And if you get a migraine, you get it. If you don't, you don't get it.
Right.
It's not, you just have a headache, we expect you to show up at work.
And that's what people feel like on my behalf. I mean, I've had 2 migraines, and they were when I was pregnant, and I cocooned myself in the room. The lights were out. I did everything that I heard to do with people that got migraines.
Yeah.
I'm like, okay, turn the lights, but it put me out.
Yeah.
And I almost, in a weird, sick way, I'm glad it happened to me, because now I can relate this much to people that do get a hold of me and say I have a migraine. Now, we are asking everyone that is on Facebook with us right now to please ask your questions. You have your neurologist right here. He would love to answer your questions. So please, we're just going to talk between us. But what is a migraine?
Okay. A migraine is more than just a headache. If you look at how we classify it and characterize it, it actually has 7 stages. People often think of migraine as having to have an aura, changes in vision, for example, but symptoms that are not pain-related, and that can then precede pain. And it is pain that is most disabling, but people have aura, for example, it looks like a stroke. And these people can have stroke-like symptoms, weakness, they can't talk, for upwards of 30 minutes to 60 minutes, and that can be as disabling as what then follows, which is the headache. And the headache is what is most incapacitating. It is typically, and there are very simple criteria to define migraine versus other headache types, which is unilateral, one-sided, it typically throbs or pulses, nausea or vomiting can happen, but not everybody with migraine has those. What's most important is that they cannot function. They are incapacitated, and even simple physical activity like walking, bending over, they can't do it. All these people want to do is crawl inside a cocoon, lay still, don't talk to them, because they are irritable as heck, and they are dumber than a tree stump. They cannot think because of the pain being so severe. And the thing is that the headache then lasts, and then when it's all gone, people are hungover. And everybody I talk to when I see them in the office, they say, and then you're drawn out for another day, and they look at me like, wow, you really get it. And being hungover can be as debilitating as going through the pain.
So you're really out. I mean, some people leave half day and they're out a whole nother 24 hours.
Oh, at least. There are people, there's a condition called chronic migraine where they have these types of severe pain going on for 15 days a month.
Gosh.
Okay, and that's called chronic migraine. So these
so
people are
bad
out
15
completely.
days,
Correct.
Good 15 days.
Oh, not even that. But they're disabled. That's chronic migraine. So it doesn't have to be episodic. And a lot of people have chronic migraine, and there are risks associated with episodic migraine, which is where most people start. Brief episodes, they're done, and then they're headache free, and they're great until it happens again. But then there's a small number of patients, and there are risks associated with it. But when you get into chronic migraine, then you're talking about real disability. And part of what I do is disable people. FMLA, okay, which is a work-related, HR-related allowance for people with migraine to be out of work with the expectation this is going to happen, so they're not dinged every time they get a headache and their employer says, look, we can't work with you anymore. It becomes a real problem. Like I said, disability is the name of the game with these things. You don't function when you've got one. Okay, so
I just heard this morning, not even this morning, a woman goes, I gotta go. I feel a migraine coming on, and I'm gonna go get some caffeine.
Right.
So now we're looking, people know that they get these migraines. They know kind of how to peel them back if they don't go too far so far.
Right.
And what are your remedies? What do you suggest to people what can they do to bring it back?
If you're into it or you're about to go into it, that's one of the most difficult things to do. If you know migraine, then at least you have some warning. The problem is a lot of people don't have that warning that you were describing. I know I'm going into it.
Okay, and some people do.
Some people do. And if you don't, you really are left with having medication around or having medicine taking every day to prevent that from happening. But if you do have a warning, of what we call prodrome, there are people who have symptoms that can last for hours, maybe even a day or so.
Sure.
But it always happens with their headaches. But this takes time to really learn it. Let's say you do, like your friend.
Yeah.
There are ways of trying to abort the headache attack, and caffeine is one of them, putting yourself in a more calm, relaxed place. And sometimes meditation can be helpful. Part of the problem is that doesn't always work because this prodrome or the aura symptoms which can occur are part of the headache attack.
Got it.
And so you really are, to a degree, a lot of these people realize that started, they're up the creek without a paddle, and they're really left with dealing with medication. The irony is the medicines that we have only work once the pain begins. I can't give you something to take with the aura.
Yeah.
We try.
Yeah.
Because we figured if you have the aura, you have the warning, you can take something then. You can abort the whole attack before it gets into pain and disability. Doesn't work. We're still getting there, but we haven't gotten close to it. So if you can, you try to get yourself to a place where it's calm and then hopefully not have medicine. But what I tell people with migraine is always have your medicine available. At least you got your fallback if you need it.
Good.
So that's the problem. Then the most effective way of treating them and preventing is just that. Medication every day or relaxation, good, strong lifestyle, healthy lifestyle, things like that on an everyday basis, which is key to preventing migraine. It isn't just pills. I don't like playing with drugs all the time. Better living by chemistry is cool, but to a limit.
Yeah.
And a lot of people don't like it. So you're also talking about other means that are not medication-based. And we have good studies.
Well, we were just talking over here, and you guys didn't catch it, but with the studies, the natural remedies or the vitamins and the essential minerals and all that, you were just talking about B6, B12.
Correct.
What was it, CoQ10?
Coenzyme QQ10, magnesium, niacin, which is B3, riboflavin, which is B4,
niacin,
melatonin, and melatonin works even if you don't have a sleep problem. These are all that have been studied. And there are two herbal remedies. One is butterbur, and the other is feverfew. And quite often you see a combination, a lot of the, not just health food stores, but CVS or Walgreens, called MigraLeaf, which is feverfew, magnesium, and riboflavin. And they've been studied, and they have been very effective. The thing is that you've got to be on them for a couple of months, but these are more natural remedies that can be very effective, and we often use them in women who are pregnant or thinking of pregnancy because they're safe.
Okay. So, again, and you and I understand this because it's the world we live in, but we stay very active and we stay persistent and consistent with our activity, right? So anyone that has chronic migraines or migraines here and there, we want to share that awesome remedy of consistency and persistence. So if you know you're prone to them, these are the remedies, the natural, non-chemical drugs that we can start bringing in every day, and it's not going to hurt us.
No. These are one of the nice things. And the other things, even without those, It's just people with migraine really have to spend some time, and it's work, understanding their headaches, what triggers them, because people with migraine get other headache types, and they're going to respond differently. But if you know what your triggers are, keeping yourself in a good, healthy environment when you're working or at home, working out regularly, regular exercise is critical for doing this.
Yeah.
Being overweight is a clear risk factor for developing chronic, more frequent migraine. Okay, so consistency in that sense, good diet. There is no singular diet that works than any better than the others, but making sure that you eat regularly, you sleep regularly, good sleep, just what you think is automatic, natural. Sometimes people just can't, professionally, familial obligations, whatever, but you have to be able to do those kinds of things as much as you can. And it's not that you have to go to the gym and work out with somebody all the time, but it's always important to keep yourself as healthy as you can be. Eating regularly, sleeping regularly, that sort of a deal. And if you recognize that there is a trigger, simple things of trigger avoidance. I mean, if you know that for a lot of women, about 60% have an association with their periods, okay? So if at that time you don't want to go out and party, you don't want to be sleep deprived, you want to avoid certain foods, you avoid that cocktail that will set you up, you can avoid giving yourself a headache. So it's a simple lifestyle change, but it's a lot of work. It's not easy to do.
And when you're talking, it resonates with me because these are life experiences. Like, you have to experience them, and then you have to experiment with them.
Oh yeah.
You know, and see what works for you and your lifestyle. And that's hard to do in a day. It's hard for you to diagnose someone probably. But this is what you need to do, this is what you need to eat, because that's not the case.
It's not always the case. It's not easy, and everybody's different. I can have 10 people in a room with migraine, diagnosed migraine, and they're all going to respond differently to medicines. They're all going to have different symptoms, and different symptoms within their own headache.
Right.
And they're all going to
different.
Everything's different, and it's still migraine.
Okay.
And that's the difficult pattern. And the frustrating thing is that I can tell people, don't do this, and they tell me, Doc, you told me to do this, I did it, and it works, and then one time it didn't.
Nope.
And it's like,
and you just shrug your
know,
shoulders.
it's just,
like,
I can't. You're right.
Luck of the draw.
That's what happens. And that's where, again, if that happens, medicine still does play a role. It has to, because you can be the best meditator in the world. You can be all of those kinds of things. You can have somebody just right behind you if you get into an attack, and they can do acupuncture for you. It just doesn't work as well as medication. And that's the problem with migraine. Now, if you wait long enough, yes, and most people, migraine does go away. Yeah. Most women, it's menopause. The problem is migraines start when you're much younger, so you've got a few decades left. So I can't tell you, just wait it out.
Yeah.
No, that doesn't work. It doesn't work.
Again, if you guys, we got a few people that are pro Dr. Spivack. So Samantha says hello, and then Walter Valine says hello. So thank you guys. If you do have any questions, please ask us right now. Really not me, Doc, right here. But Doc, another thing that you did touch base on, and I want to go into a deeper thread, is our foods. So this is my theory. Food is our medicine, the ultimate medicine, right? And then Doc comes in and he says, do this and this, and this is our bonus, and all of it collaboratively could be our cure-all, or maybe not. Who knows? But I do know with food that if we go into a non-processed area, maybe gluten-free, maybe attempt all organic, maybe it's more fruits and vegetables, but what we're saying here is go into a cleaner thread of foods, right?
Absolutely.
Because there's not one food that there's deep research like, yep, eat apples and you're not going to have migraines anymore.
No, there's no data for anything like that. We do know that certain foods are more likely to trigger them, but that's not the case with everybody either.
And that's where the experiment comes in. Like, okay, try that food. And
my recommendations are with people with diet and food is don't let the fact that you have a migraine limit what you're going to do, because you cannot predict if that dietary change is going to have any effect on your headaches. If it's a healthy dietary change and you feel better, then it certainly logically is going to help your migraines, but I can't guarantee it. So my thing is, don't limit what your decisions are in that sense. Go for it. Not everybody needs to be gluten-free. If you choose to do that, more power to you. It doesn't mean now if you have a gluten sensitivity, yes, it's going to make a big difference. Obviously.
But we hear, I mean, again, Doc, like, there's so much information on the internet. Like, you can Google search something, and then that, Sally says, oh, I gotta drink, I gotta eat bell peppers, 10 of them a day, because this doctor said that, you know. And I'm sure you laugh like this because I, on my side in the field, I mean, one girl has her remedy, this guy has his, and we do it.
Yep.
And so I guess what I'm stressing, just listening to, is play the experiment game and see what works for you, right?
But be smart. I mean, if you're going to do a dietary change, do it with somebody like yourself who knows, who's had experience with it. Don't just go out there and look at the web. You're right. There is an immense amount of info on the web, but is it studied? Is it scientifically based?
Is it researched?
Right.
Yes.
That, to me, is important. They're the obvious things of staying healthy, okay? And other than that, if you are going to try something that's different for you, make sure you do it with the right guidance, okay? Because if you have the right input of calories, so on and so forth, you should be fine and healthy with it. And a healthier lifestyle, which is what I had said before, is key. It keeps your migraines under better control. It will help, and it certainly will help you rebound if you get into a full-blown. Heck yeah.
Well, and then that's that theory in life in general. We all get below the line. Sometimes, you know, and for us that love the 80-20 lifestyle, I want to live 80% awesome and 20% not so awesome, right? But
you'll allow us,
but it's not a matter of like, okay, what did I do to get below that line? It's how my concept is, how quick can I get back up? So the bounce back for a migraine can be stronger and better.
It can be, but also it still takes time, and part of the issue is that sometimes people feel there's something wrong with me because I'm not bouncing back any more quickly, and it's not. Migraine is a brutal condition. You will get back to being there, so don't find there's a way of. It shouldn't morph itself into a self-critical sort of occurrence because it becomes self-defeating. You have an attack, it will go away. People are not injured by migraine. They feel like it. A lot of people with a full-blown migraine would rather be dead. Right, exactly.
Okay, I had him twice,
they
and I'm
take
like,
death.
oh my gosh.
They would take death over it.
Okay.
But the thing is that you do bounce back. And you do well between them.
Okay.
People can do very well between them.
One last thing. What's this whole car talk that you're talking about? A Ford, a Ferrari with migraines?
Oh, okay. All right. You caught me on that one. I'm a car guy. I like cars, but part of the concept of migraine is really trying to understand why, because a lot of people who I talk to and treat ask me, why am I getting these? Right. And I said,
what you're doing right now, Doc is breaking this down right now in very
I'm
simple
trying to make
form,
it very
so
simple
we
terms
can understand this.
Anybody can understand it. Look, any one of us can get a migraine. What I often tell my patients is, look, when was the last time you tied one on? 9 sheets to the wind, faced, flat out, okay? What do you remember after the next day? Okay, you've got a headache. Most people who are drunk and in a hangover are throwing their guts up. They've got a headache. They can't think. The public perception is on movies is the next day the person's got sunglasses on in a cafe, irritable as hell, drinking what? Caffeine. What do you think a hangover is? It is a migraine. A hangover is a full-blown migraine.
Is a migraine.
So the thing is, any one of us can get there. The threshold is there, and I use the analogy of an RPM in a race car. 10,000 RPM is the threshold. We cannot play with that threshold with anybody. If you cross it, bye-bye, you're toast. Okay, I can't help you other than drug. What can we do to prevent you from getting there? A migraineur, okay, a trigger might be a glass of wine, for example, okay? For somebody who doesn't get migraine, their triggers are going to be bigger. So if you think of 10,000 RPM as the threshold, migraineurs are always at 9,000. Migraineurs are a Ferrari. They're revving and idling at 9,000, so it doesn't take them much to cross that threshold. You know, a weather change, okay, a cycle change, a simple stressor, they haven't slept well the night before, they're done. Now me, on the other hand, I'm down here at 2,000. I'm a Ford Model T.
Yeah, what car are you?
I'm a Ford Model T. I'm just puttering around here. I'm having a grand old time. I can cross that threshold, but I need a fifth of vodka, not a glass of wine. But I can still cross that threshold. I still die. I still have the same horrible experience. That's what migraine is about. People with severe migraine aren't coming into the office so that we can change that pattern. We can't. What they want us to help them is reduce the frequency and the severity of their headache attacks, and we do that by dropping their idle. If I can get every migraine sufferer from 9,000 to 1,000 RPM, they're not going to get headaches. If they do, the headaches will not stay at 9,000. They'll drop to 2,000 once they're treated, and they won't come back on the day later or the next week. They'll stay at a lower level. Wow. So they're happier. So that's kind of what I think of as an analogy when you think about migraine and what the difference is.
That's beautiful, because
Okay.
I think people get nervous to talk to doctors like you and be like,
Well, with me,
Mr.
I understand
Science,
that they would really be frightening to look at me.
No, but just any doctor,
Sure.
it's somewhat intimidating, because you're the brains and
Wow.
you're everything in that world. And when you speak like that, Doc, and hopefully someone gets a more understanding and better understanding
so.
with hearing
I
that,
hope so.
because that makes a lot of sense.
Yeah.
Now, we'll break it, or we'll come down from this conversation. And again, if you guys have any questions, please ask online. Thanks, Lewis. We're getting the word out about these migraines, and
Yep.
hopefully help someone.
Thank you.
Right?
Appreciate it. Absolutely. Absolutely.
But please ask questions to Doc on this thread, and I'll make sure that he sees them and make sure that we get these questions answered.
I'm
if you do
definitely
have
not
any.
seeing them now. Man, they are small. I am totally missing this stuff. Keep sending them in.
Yeah, keep
Please
sending
do
them
it.
in. I know, but Doc, in a nutshell, is there a cure for migraines?
No, there ain't no cure.
Okay.
If there were, I'd be a rich man, and I'd be driving my Ferrari and having a grand old time and not having to worry about it. No.
Okay.
There ain't no cure.
Okay.
Not yet.
So we're just doing everything that you said. Yeah. That's how we're handling them.
Perfect.
And
that's what you do. I mean,
okay.
they are, look, because of the disability, because people who have these feel so out of control, they are scared, they are frightened, and they don't always get the support that they need from family, friends, work, so on and so forth. Sometimes it does require help from a physician. Get some help, okay? Even if it's just with your primary, at least some medicines can be introduced, or get a direction to a specialist. Myself, most neurologists, we're the people who end up seeing these guys because that's what we do, okay? We treat headache. And a lot of people are also concerned because migraine sufferers can get other headaches. They can have horrible conditions. And the most common comment I get in the office is, Doc, I have to have had an aneurysm, a stroke, a hemorrhage. There's got to be a tumor. Right. And of course, none of this is true. But that's the other thing you also want to be careful of, is you don't want to miss those things. Yeah. Most of the time, like I said, migraine, it's benign. People live normal, healthy, productive lives. They're just miserable when they have a headache.
Yeah, my cousin suffers from them badly, and it's one of those things where compassion is at the highest point for her, just because she misses. I feel like she misses out on so much.
I'm sure she does.
I'm sorry to all those people that do have migraines, but it's very warming to know that you can do a few things to maybe take it down a notch.
We're there to help.
Idle it.
We're there to idle it down. Exactly.
Okay. This is a personal question on behalf of your profession, but what's the one thing that you still, after how many years of being in the field, that you love?
Believe it or not, is diagnosing some of the more complex and diagnoses that we haven't talked about today, which are the degenerative illnesses. They are phenomenal illnesses. They're horrible because we have no cures, but I find those are still the most interesting. Migraine is wonderful simply because these are healthy young individuals. They've got great outlooks on life, and they're cool to treat because you can treat them. These people walk out of the office, they have control of their lives again.
Like
and I'm just there to say, hey, I'm here to help you.
Right.
Oh yeah, no. You need those patients. Everybody loves these kinds of patients because they do so well.
Right.
And there's such great thanks for them. On the other stuff, the interesting stuff is unfortunately some of the more morose and more difficult conditions to treat. Yeah. But you still provide counsel and help to families because there's little that can be done, but they still need counsel. They still need help. They still need uplifting advice, and that's what they look for.
Right. How long have you been in the profession?
I've been practicing since 1991, so do the arithmetic. Pushing 37
I'm
years.
awesome at math, Doc. Thanks a lot.
I know that. No worries. 27 years.
Woo! That's good. 1991. I was almost going to high school.
Yeah,
whatever. Yeah. Well, cool. So we're. There was one on here, Doc. Hold on. Let me go in here. So hi, Shell babes. So Shell says, can you see this? Headaches. I have one right now. Pregnant so far.
Yeah. They told me the mold and allergies are awful. Something controlling to mine. Currently, especially. Okay, mold and allergies, yep.
What do you do? Oh, gosh, I'm so sorry, babes. I cannot read that. But, yeah, I'm not able to read that.
I got the gist of you're pregnant, you have a bad migraine, mold, allergies make them worse. You're right, part of the problem with pregnancy...
Oh, and she lives in Iowa.
Hey, you got a lot of it. part of the thing with pregnancy, again, is a lot of the medicines that we use are technically FDA unapproved, though we still use them. You didn't hear me say this.
Right.
But you are more limited. Yes, there are medications. Believe it or not, the one class of medicine that we use to help rescue or get somebody out of a migraine is a narcotic. They're safe. Okay. Tylenol, there are other medicines that can be used, but you're kind of limited, unfortunately. During pregnancy, that's when we use the supplements to take every day to prevent them, but they're not going to help you when you're into one. You really are kind of limited as to what you can do, because there is some data looking at blood flow to the placenta in the baby when you use these medicines. Specifically, I'm talking medicines like Imitrex, triptans. So you're kind of limited, so I'm not much help on that one. It's more if you find or thinking of becoming pregnant, what can you do ahead of time? Okay, but mold, all of those things will trigger it. And when you're pregnant, the problem is once you deliver, at least your headaches will return to your pre-pregnancy pattern. So if you had very few, that's where you will go. Unfortunately, with subsequent pregnancies, usually that increase in headache pattern will happen again. Equal proportions of women, there's no change in the headache. They get worse or they get better. And you can't predict that.
Yeah.
But it's always going to be that same pattern for any given woman with pregnancy moving forwards. So if you know that, then you can at least plan ahead and say, okay, I know I'm up for a nice vacation because I'm getting pregnant and I'm not going to have any headaches. Or you could be the other unlucky bunch, which is two-thirds, which is I got bad ones and they ain't going to get any better and they're going to get worse. So in that case, you work on supplements, taking them before you're getting pregnant. You get them all on board. And then there are medicines that can be used. You just have to watch, and they need to be done under the guidance of somebody with medical training and knowledge.
Okay. I just sparked this, but Botox. I mean,
our Image Conscious Society.
Okay.
Botox.
I got Botox for the migraine. I promise. No other reason.
Yeah.
But some people do.
No, absolutely.
And what does that do? I mean, I have no idea.
Botox works. We do know that the botulinum toxin does actually get into the brain itself. Okay, even though it's injected superficially, it's not by a muscle relaxation effect, though obviously that's what it does do cosmetically. But it does work. It is FDA approved for chronic migraine. These are the people with more than 15 days a month of intractable headache.
Yes.
It's very effective. In fact, there are only 2 FDA approved treatments. One is Topamax, which you must avoid during pregnancy. Botox is safe. And in fact, there's no data saying that Botox really is contraindicated in pregnancy.
No kidding.
So you kind of have to, because there's no FDA saying it is definitely approved. It's just that there's no disapproval saying it must be avoided.
Right.
So I have used it in women. It's off-label, but I have used it in women who are pregnant, and they do very well with it.
Okay.
But Botox is very effective. It's every 3 months. There's a series of 31 small injections across the forehead, both sides, both temples, and several down the back of the skull and into the neck and shoulders. Very effective.
Unreal. Okay, so that's a true statement.
That is a very true statement.
Okay, so these women.
And if you have some extra, you can do the cosmetic thing every once in a while.
All right, and they're going to look good. But that's great to know.
That's exactly
it really is. So it's not a myth, and that's something.
No, it is not a myth.
We did want to talk about myths versus facts. So.
Oh no, that is very true.
Okay.
Botox is it.
If you could say one myth for migraines, what would it be?
Ooh,
one myth. I'm on the spot right now.
Wow. Okay.
Or we can go the other way.
No, I'm trying to think.
Okay.
I'm trying to think. What's a good one? Well, again, we talked about it before. We can cure migraines. No, we can't cure it. We can treat it.
Right.
But there's also a myth that we have come closer to curing it, and that also is just not the case. Okay.
Big myth.
There is also a myth that somehow migraines have to control your life, and that is also not the case. You can, with help from others, family, but also with healthcare providers, if necessary, you can get your life back. You don't have to give it up simply because you have these horrible headaches. That is a myth. Okay. You don't have to give it up.
Good.
Okay.
Super fact about migraine, and then we'll leave it at that.
Yeah.
What's the biggest fact about a migraine that if someone just tapping into this video right now that you would like to share with them about migraine, whether it's I have hope for you or
You always have to be, the super fact about migraine is that they don't hurt your brain. Okay, people swear that I've got to have this horrible experience.
Something's happening in
wrong,
there.
and
Yeah.
I'm going to really be my brain is going to be damaged, and that just is not the case. Migraine is what we call a benign condition. It's its own thing. You have them. You can blame mom most of the time. 9 out of 10, there's a genetic risk. 3 out of 4, it's women. So if you got it in the family, look on mom's side, because that's typically where it's coming from. But these are benign conditions. They don't shorten your lifespan. They don't damage your brain. It just doesn't. They're horrible when you have them.
Okay. There's a lot of hope. Okay.
Yeah. Oh, yeah.
Well, thank you so much, Dr.
Hey.
Jonathan Spivack here, neurologist.
Thank you very much for taking the time. They're online. I appreciate it.
Yes. And again, if you guys are just tapping into our little show, Wellness Wednesday, and you watch this whole thing, please ask questions, and I'll make sure that Doc sees all these questions.
I get them.
And,
hopefully I can help.
Yes. And again, I just want to thank you for your time and everything that you do for
thanks very
Reno.
much for having me.
Heck
Appreciate
yeah.
it. Thank
I love
you.
it.
There you go.
Oh, and I got to tell everyone, all my friends, this guy works out so hard
Oh, Lord.
every Tuesday, Thursday. Super rad athlete here. And I know you're a crazy brain yourself,
Right. Yeah,
okay?
right.
But it's really cool to see a doctor be so real and so amazing in the gym and live that lifestyle. And then not to mention, he's probably one of the best dressed men I know.
Oh, Lord. I'm paying her for this, by the way.
No,
She's getting a lot of money for this
I'm
one.
not. I mean, he's mild right now. He took his jacket off, but dude is slick. So just thank you so much for your time.
Thank you.
And
Thank
we'll
you very
talk to you
much.
guys later. See you
Absolutely.
next Wednesday, you guys.
Peace.
Peace.